In this episode of the Huberman Lab podcast, Andrew Huberman interviews Dr. Mark Desposito, a neurologist and professor of neuroscience and psychology at the University of California Berkeley. Dr. Mark is an expert in brain mechanisms controlling executive function and memory. Executive function is crucial for daily life as it involves cognitive strategies, decision-making, and goal setting. The frontal lobes, particularly the prefrontal cortex, are responsible for executive function. This includes planning, organizing, goal setting, and cognitive control. Damage to the frontal lobes can result in difficulties with decision-making, prioritizing tasks, and adapting to new situations. The frontal lobes continue to develop into the early 20s, which explains why adolescents may struggle with impulse control and decision-making. Mild frontal lobe damage can manifest as difficulty setting priorities, getting distracted easily, and struggling to achieve goals. Severe frontal lobe damage, often caused by neurodegenerative diseases or brain injuries, can lead to more pronounced issues with behavior and decision-making. Patients with frontal lobe damage may exhibit impulsive actions and have trouble following social norms. The prefrontal cortex stores rules and algorithms that guide behavior in different contexts. These rules are hierarchical, with different levels of rules for various situations. For example, when faced with a decision, the prefrontal cortex accesses the appropriate rule based on the context. Patients with frontal lobe damage may struggle to apply these rules effectively, leading to impulsive or inappropriate behavior. The prefrontal cortex can learn and generalize rules to different situations. Cognitive therapy, such as goal management training, aims to improve executive function and memory by teaching individuals how to apply learned strategies in real-life scenarios. While initially challenging with therapist-driven interventions, individuals can learn to translate cognitive skills to everyday tasks. Individuals can train their prefrontal abilities to improve focus, attention, and cognitive control. Strategies such as setting goals, maintaining focus, and overcoming distractions can help strengthen the prefrontal cortex. Generalization of learned rules and strategies to various contexts is possible with practice and cognitive training. Goal management training is a therapy developed to enhance executive function skills and translate them into real-world tasks. Patients engage in individual projects, such as planning meals or vacations, to practice goal setting and decision-making. This therapy requires dedication and effort, but has shown success in improving executive function abilities. Working memory is the ability to hold and manipulate information in mind for a short period of time. It is essential for tasks such as problem-solving, decision-making, and comprehension. The frontal cortex plays a crucial role in working memory, as it is responsible for maintaining neural activity related to the information being held in mind. The frontal cortex is highly interconnected with other areas of the brain, allowing it to send top-down signals to prioritize relevant information and ignore distractions. It also plays a role in controlling physiological functions such as heart rate and respiration. The frontal cortex works in concert with other brain regions to coordinate complex behaviors and responses. The use of smartphones and technology can impact cognitive function, particularly in terms of working memory and decision-making. While technology can provide access to information and facilitate certain tasks, excessive reliance on devices may hinder cognitive skills that require active engagement and problem-solving. Engaging in physical and social activities that involve rule-based interactions may offer more benefits for cognitive function than passive screen time. Dopamine is a neurotransmitter that plays a key role in motivation, reward processing, and cognitive functions, such as working memory. The circuitry involved in working memory includes the frontal cortex and other brain regions that support the maintenance and manipulation of information in mind. Dopamine can modulate neural activity in these circuits, enhancing working memory performance and facilitating goal-directed behavior. There are two dopaminergic systems, one that goes to the basal ganglia, important for motor function, and another that goes to the frontal cortex, crucial for working memory. Individuals with low dopamine levels can benefit from increasing dopamine through pharmacological means, such as the drug bromocriptine. However, there is an inverted U-shaped relationship between dopamine levels and working memory. If dopamine levels are already high, further increasing dopamine may not provide additional benefits and could even worsen working memory. Currently, there is no blood test available to measure dopamine levels accurately. Dr. Mark mentions that positron emission tomography, PET scans, can be used to measure dopamine levels in specific brain regions, such as the prefrontal cortex. Additionally, genetic studies can identify variations in enzymes that break down dopamine, providing insights into individual dopamine levels. Despite the potential benefits of improving cognition through neuromodulators like dopamine, the pharmaceutical industry has not shown significant interest in developing drugs for cognitive enhancement. Dr. Mark highlights the need for targeted therapies to address cognitive deficits across various conditions, rather than focusing solely on disease-specific treatments. Aside from bromocriptine, other dopamine agonists like guanfacine can also improve working memory by boosting dopamine levels. Dr. Mark emphasizes the importance of finding the right balance of dopamine in different brain regions to optimize cognitive function. Dr. Mark discusses the use of drugs like Wellbutrin, which acts as a norepinephrine agonist, to improve working memory. He also mentions the role of serotonin and acetylcholine in enhancing cognitive processes indirectly related to working memory. The idea of developing a cocktail of neuromodulators tailored to individual neurochemistry is proposed as a potential approach for cognitive enhancement. While there are claims of blood tests that can assess neurotransmitter levels, Dr. Mark stresses the complexity of measuring dopamine balance in different brain regions. He suggests using behavioral proxies like pupil dilation as a potential indicator of norepinephrine levels, highlighting the need for more precise biomarkers to understand individual neurochemistry. The use of pharmacology for cognitive enhancement, including stimulants like Adderall and Ritalin, is a common practice among students and individuals seeking improved focus and performance. Dr. Mark acknowledges the potential benefits of pharmacological interventions, but emphasizes the importance of monitoring and guidance from trained professionals to ensure safe and effective use. Dr. Mark explains that a concussion is a tearing of axons in the brain, which can lead to symptoms like mental fog, difficulty focusing, and sensitivity to light. While most concussions heal on their own, some patients may experience persistent post-concussion syndrome where symptoms linger for a year or more. He highlights the importance of optimizing sleep, nutrition, and activity to support recovery from traumatic brain injury. Dr. Mark stresses the need to optimize brain health by engaging in activities that challenge and stimulate the brain. He mentions the Brain Health Project at UT Dallas, which aims to develop a brain health index to measure and track brain health over time. He suggests that having a measurement of brain health can help individuals assess if they are optimizing their brain health effectively. In addition to sleep, exercise, and nutrition, Dr. Mark discusses the importance of engaging in activities that promote cognitive function. He mentions the benefits of reading fiction, learning new skills, and playing musical instruments as ways to challenge and strengthen the brain. He acknowledges that balancing a busy career with personal activities that promote brain health can be challenging but essential for overall well-being. Dr. Mark mentions the work of researchers like Mike Merzenich in developing brain training games that can improve specific cognitive functions, including working memory. He highlights the importance of engaging in cognitive training activities to maintain and enhance brain function, especially after traumatic brain injury or concussion. He emphasizes the need for accessible and evidence-based brain training programs to support cognitive enhancement. Dr. Mark shares his personal experience of consciously starting to read more nonfiction books and engaging in activities like reading history and literature to enhance his cognitive abilities. He emphasizes the importance of continuous learning and cognitive stimulation for brain health. The discussion shifts towards neurodegenerative disorders like Alzheimer's disease. Dr. Mark explains the challenges in treating Alzheimer's, mentioning the lack of a definitive cure and the complexity of the disease's pathology. He discusses the role of neurotransmitters like acetylcholine in Alzheimer's treatment and the need for more research in this area. Dr. Mark explains the impact of Parkinson's disease on dopaminergic function and the use of medications like levodopa to manage symptoms. He also mentions the potential benefits of nicotine in boosting dopamine levels and its role in cognitive enhancement. The conversation delves into the influence of estrogen on cognitive function, particularly in women. Dr. Mark discusses a study that explored the relationship between estrogen levels and dopamine activity in the brain, highlighting the importance of hormonal balance in cognitive health. The podcast explores the connection between physical exercise and cognitive function. Dr. Mark mentions studies that show the benefits of aerobic exercise in improving executive function and working memory. He emphasizes the role of exercise in enhancing brain health and cognitive abilities. Dr. Mark discusses the impact of mindfulness practices on cognitive function. He explains how mindfulness training, when combined with cognitive therapy, can improve executive function and focus. He shares his personal experience with mindfulness and meditation as tools to optimize cognitive function. He describes a practice called yoga nidra, which involves relaxation techniques and body scans to promote mental and physical vigor. Mindfulness meditation helps him gain a different perspective on problems and enhances his focus. The podcast touches upon emerging therapies like psychedelics and their potential role in treating neurological disorders. Dr. Mark acknowledges the evolving landscape of neuroscience and the increasing interest in alternative treatments for brain health. Dr. Mark emphasizes the importance of understanding the brain as a network of interconnected regions rather than focusing solely on individual brain areas. He explains that the prefrontal cortex acts as a hub in the brain network, facilitating communication between different regions. Modularity, or the degree of segregation between brain networks, plays a crucial role in cognitive function. Higher modularity is associated with better cognitive performance and response to interventions. While transcranial magnetic stimulation, TMS, has shown promise in treating depression, Dr. Mark discusses its potential application for cognitive enhancement. He mentions studies that have demonstrated improvements in working memory with TMS stimulation of the frontal cortex. However, he emphasizes the need for further research to determine the generalizability of these effects and the optimal use of TMS for cognitive enhancement. Dr. Mark addresses the impact of substances like psilocybin on brain connectivity. He explains that while psilocybin may increase resting state connectivity, it may not be ideal for cognitive function. The balance between network communication and modularity is crucial for cognitive performance, and interventions should aim to restore this balance. In his clinical practice, Dr. Mark considers a combination of drug therapies, cognitive training, and TMS for cognitive enhancement. He highlights the importance of restoring network communication in the brain to improve cognitive function. By targeting specific brain regions and modulating network activity, interventions can enhance cognitive performance and overall brain health. Dr. Mark emphasizes the role of patients as advocates for their own brain health. He encourages individuals to educate themselves about the possibilities for optimizing cognitive function and to engage with healthcare providers in exploring potential interventions. By understanding the underlying mechanisms of cognitive function and the impact of interventions on brain networks, patients can make informed decisions about their brain health.